Usually arthritis of any joint is a very chronic progressive disease. So it takes around a few years for a stage 1 arthritis to reach a further severe stage. For instance, in the knee, it takes around 10 to 15 years for a stage 2 arthritis to progress to something that would require surgery. Let's say if you have a rheumatoid arthritis, then this accelerates the degenerative process. So it is ideal to diagnose and treat this condition, because once this progresses to something that requires surgery, then there is no going back. So based on the stages, we can tailor the treatment plan based on the patient as well. So for stage 1, there is very minimal cartilage damage, and it's very minimal changes that you see on the x-ray. At this stage is very vital, because this is where the joint preservation starts. You can prevent any progression by avoiding lifestyle changes like avoiding squatting, and you can do your physiotherapy and quadricep strengthening exercise to prevent progression. In stage 2, you see a bit more progress in the x-ray. There's going to be a bit more cartilage damage, and there is going to be seeing early signs of joint space reduction. At this stage, a lot of patients we see will have another modality of injuries around the knee, of the soft tissues, of the meniscus, and of the other cruciate ligaments as well. So treating that and maintaining soft tissue balance and strength is important at this stage. Stage 3 is when you come to a more severe sort of arthritis, when this patient can actually feel the pain and patient's lifestyle is changed because of his knee pain. So this stage, there is a gray area, and here the newer modalities like orthobiologics and PRP are a very important factor here. So we traditionally use platelet-rich plasma and viscoelastic supplementations like hyaluronic acid to regenerate the torn cartilage to some extent. Now recent modalities like PSRT, which is pulse signal repair therapy, has also shown to cause a lot of delay in the progression of the disease, and also reducing the inflammation and pain around the joint. Once this disease has progressed to stage 4, there is very less chance of avoiding a surgery. You'll probably require total knee replacements or unicompartmental knee replacement. For the early stages, where there is a bend on the knee towards the inside, what we call varus, maybe a high tibial osteotomy can also be an option. So delaying getting a surgery done once you've been diagnosed with a stage 4 osteoarthritis can have significant impact on your lifestyle, like walking around, doing daily activities, and also make your knee have deformities and make you have a difficult sort of gait. So knowing which stage that you diagnose about osteoarthritis and knowing how to manage the soft tissues and muscular strength around it is significant in preserving a joint.